about is respirations. You've already counted the respiratory rate probably. At this point, we have noted whether her respirations are even and regular. We want to know whether she's breathing shallowly or if she's really breathing deeply. Some people who are having respiratory difficulty, particularly like for asthma, I came home one day, my daughter was breathing with about this much of her lungs maybe, so she could only take shallow breaths. She couldn't get anything down in there. Just didn't work. And she's not using any accessory muscles. So people are having difficulty breathing. You'll see them actually using their neck muscles. And sometimes you'll see almost look like you're skinning the skin between their ribs because they're really working hard to get that air in. We're going to look at her spinal alignment. And so I want to make sure that her spine is straight. Okay. You can have her do that at another time also if you want to, and just have her bend over and kind of see whether one shoulder is higher than the other, indicating scoliosis. I'm going to palpate thoracic expansion. I want to see whether her chest is expanding equally. So what you're going to do is you put your hands over the rib cage, you pinch your thumbs together a little bit and say, take a deep breath, and when my thumbs move apart equally, then I know that her chest is expanding equally. Okay? She doesn't have a collapsed lung or any of those nasty things. I'm going to auscultate breath sounds, and we want you to do at least 6 places on back and front, and 2 in the axillary region. So make sure when you listen for respirations, A, you're on the skin, and B, you listen for a full respiration. Often I see people do, and they're off to the next one. They haven't gotten to the end of the expiration, and there are a lot of expiratory wheezes that happen at that end of expiration. Any of you who've gone to sleep and try to listen to yourself whistle, you know what it's all about. So, on the front of the chest, your lungs actually extended just above your clavicle. So you can listen there. You want to listen here, and you want to listen under the breast. Okay. So I'll just do a couple of them here. Take a deep breath. And notice how I'm standing to the side of her, so I don't get breathed on. Okay. Can you just raise your arm for a minute? For the axillary region, I would put it here and here. Okay. And then on the back, it's really, you want to cover the top, the middle, and the lower. Just remember that you don't have ribs down here. Okay? You don't have lungs down there. Try to stay inside the bone. Okay, inside the scapula, because you can hear it better. And you want to go side to side. You go side to side this way, or side to side this way. But you want to compare the sides. The axillary, not so much. You listen to your 2 places and then go over here. That's okay. Right? But you want to be sure that you're comparing the 2 sides. Any questions about respiratory system?